All right, welcome everyone to the NIOSH Total Worker Health webinar series. This particular webinar is on decent work for public health. We are so happy to have you all with us. Very quickly, free continuing education is available for this presentation through CDC's Training and Continuing Education online system. We're pleased to offer the following continuing education types listed on the screen in front of you. There are also detailed instructions on accessing the Training and Continuing Education Office site available for download at the website at the top of your screen. That is tceols.cdc.gov. Please note that the bright blue activity number is what you need for the live event. The gray activity number will allow those to access continuing education after December 19th of this year. We are recording this webinar and plan to post on the Total Worker Health webinar page as soon as possible for those who are unable to join us today. Today's featured presenters are Drs Preethi Pratap and Paul Landsbergis, with Dr. Paul Schulte moderating. Dr. Preethi Pratap is an assistant professor in the Division of Environmental and Occupational Health Sciences at the University of Illinois Chicago School of Public Health. Dr. Pratap's research focuses on application of systems thinking principles and participatory action research methods to engage stakeholders across the work ecosystem, to co-create knowledge and inclusive evidence for broader policy, systems, and environment change initiatives to promote and support workforce health and well-being. Currently, Dr. Pratap is the principal investigator on workforce health and well-being for all as a sustainable business strategy. This research project is part of the Center for Healthy Work, a NIOSH Center of Excellence for Total Worker Health. The project focuses on engaging employers as key stakeholders and highlighting their role in contributing to workforce health and well-being. Dr. Paul Landsbergis is an associate professor in the Department of Environmental and Occupational Health Sciences, State University of New York, Downstate Health Sciences University School of Public Health. Pardon me. He has extensive research and teaching experience on social epidemiology, work organization, work stress, workplace interventions, lean production, socioeconomic health inequities, hypertension, cardiovascular disease, and more. He has served as a member on the National Institute for Occupational Safety and Health Intervention Effectiveness Research Team, and was a member of the National Research Council's Committee on the Health and Safety Needs of Older Workers. And finally, our moderator, Dr. Paul Schulte, is a consultant and former director of the Division of Science Integration and co-manager of the Nanotechnology Research Center at the National Institute for Occupational Safety and Health. Dr. Schulte has 47 years of experience in conducting research and developing guidance on occupational cancer, nanomaterials, risk communication, workplace well-being, and genetics. He has also examined the convergence of occupational safety and health and green chemistry and sustainability. So please join me in welcoming our speakers for this presentation, and I will go ahead and pass it over to Dr. Schulte.
Thank you, Sarah, and welcome everyone. I think we're in for a real treat today. The topic of decent work is a critically important topic, and yet it hasn't received, with notable exceptions that you'll hear about today, that much attention from the occupational safety and health community. Well, we hope that we will address that issue by the presentations here today. Next slide. And the focus today is on decent work. And decent work is a term that, go back one. Decent work is a term that reflects the aspirations of people related to their work. And so it's a broad term that involves employment that respects the fundamental rights of workers in terms of work, safety, health, their pay, with respect for physical and mental integrity at work. And so it's a critically important and very broad term. Next slide. And it's a term that grew out of the formation of the International Labor Organization, which is a UN agency. It evolved since the founding of that agency in 1919. Then in 1999, it was formally promoted by the Director General of the ILO as a unifying framework and central priority of the organization. And that's when it really took off. In 2005, at a UN summit on decent work, it was made a central objective of development strategies for fair globalization. And then finally, in 2015, it was incorporated by the United Nations in their 2030 agenda with regard to goals for sustainable development. And you'll hear more about that. So that's the framework or the background. And without further ado, I'm going to turn it over to Dr. Landsbergis. Paul, the floor is yours.
Great. Thank you very much, Paul. And it's a pleasure to be here today with two experts on decent work, Drs. Pratap and Schulte. So anyway, the ILO developed this idea of decent work, and it contains 4 inseparable and interrelated pillars: employment, social dialogue, social protection, and rights at work. Next slide. So here from ILO documents, we've put the details on these 4 main pillars. What do they mean in practice? Well, rights at work refer to rights to organize, bargain, freedom of association, basic workers' rights. Also, reducing occupational segregation or discrimination by gender, race, immigration status, equal opportunity for all. Employment creation includes full employment, the opportunities for developing skills, work in the formal economy, not precarious work or informal work. Unemployment insurance. Social protection includes adequate income, decent minimum wage, healthcare benefits, decent work time, paid leave time, safe and healthy working conditions, workers' comp benefits, Social Security, and pension. And as well, parental and maternity leave to allow for both work and family and personal life. And finally, social dialogue refers to comprehensive worker and employer organizations that bargain and cover a large portion of the workforce in collective bargaining agreements. Okay, now occupational safety and health has been a key part of decent work since the idea was created, but recently it's gotten greater emphasis. Last year, the ILO added occupational safety and health as the 5th fundamental principle and right at work. Social justice is also an explicit goal of decent work. As Dr. Schulte mentioned, the idea of fair globalization was a key part of decent work. The ILO wanted to be sure that globalization of the economy occurred so that development was sustainable and all groups could benefit from it, not just some. And as Dr. Schulte mentioned, decent work is part of the UN Sustainable Development Goals, SDGs, for 2030. Goal number 8 is decent work. And various components of this SDG agenda contains aspects, features that relate to decent work and healthy work, preventing disease and injury. Now, some of you may be wondering, well, decent work sounds kind of similar to other models of healthy work and work quality that many of us are familiar with. Employment quality, total worker health, psychosocial safety climate, The healthy work campaigns focus on reducing job stressors and other models of work quality. And there certainly are similarities between these models. One nice picture here by Benavides and colleagues tries to get a handle on some of these similarities. We can look at working conditions, basically safety and health conditions, work stressors, as well as employment conditions having to do with broader conditions related to income, work hours, paid leave time, benefits. In the informal economy, both employment conditions and working conditions tend to be poor. But even as we move into the formal economy, you can still be in precarious employment where working conditions and employment conditions are not ideal. But when both of those are very good, employment and working conditions, that's more of a definition of decent work. And across all these various models that I just listed previously, they all cover similar working conditions and employment conditions, all have a more expansive view of employment and work and health than can be addressed by one profession. They're interdisciplinary. The healthy work, employment quality models tend to focus on high-income countries, but the decent work model developed by the ILO for the global economy focuses somewhat more on issues in the global economy, trying to reduce informal work, child labor, and forced labor. And so there's some differences between these models in the nature and scope of interventions. The decent work agenda focuses on national programs mainly, whereas the other models tend to focus more on specific workplace programs. One challenge for the decent work model, as described by Dr. Schulte, is that work stress-related illnesses are implied by the model, but really need to be more explicit. It needs to more explicitly capture the psychological aspects of working. So what are some of the main interventions, programs, and policies that are part of the decent work agenda from the ILO? The ILO has created decent work country programs, but also promote collective bargaining and worker cooperatives. A lot of these efforts are top-down programs, agreements between the ILO and national governments, but some are also grassroots efforts. For example, the ILO on its website lists about 64 different decent work country programs in regions all around the world. They focus on developing labor inspection systems, applying international labor standards, developing the capacity of employers and workers' organizations, developing fair labor immigration policies. One of the challenges for these programs was pointed out by Rantanen, who showed that these decent work country programs, as positive as they are, do not typically include occupational health services. So that's something that needs to be included. These programs address occupational safety, injury reduction well, but occupational health, that is disease prevention, less effectively. Another major area of efforts on the international level from the ILO is promotion of collective bargaining in programs all over the world, support for unions in various regions, and helping unions to be involved in focusing on COVID-19 challenges, involvement in wage setting, the role of unions in achieving the UN's 2030 agenda, strategy for unions on helping to organize workers in the informal economy and gig platform workers. So a variety of support for collective bargaining efforts around the world. In addition, the ILO supports the social and solidarity economy, as they call it, and a big part of that are workers' cooperatives. They provide training on developing of cooperatives, our co-op training program. They've helped develop partnerships between trade unions and the social and solidarity economy to support informal economy workers in many countries. Here's a picture of a training program to help support cooperatives development among coffee farmers in Laos. The Our Co-op training program has also been piloted with rural and informal economy workers, disadvantaged youth, women artisans, and other groups in regions around the world. Now, despite all these many efforts, the ILO acknowledges that progress towards the social sustainable development goals is slowing down in many areas of the world, and these need to be accelerated. They acknowledge that reducing the informal economy has met with many challenges. Informal work is still the reality for the majority of the global workforce. Some other efforts at the international level, and these are not mainly through the ILO, these were more grassroots efforts. For example, in response to a tragedy 10 years ago in Dhaka, Bangladesh, where more than 1,000 garment workers were killed in a factory building collapse, Bangladeshi trade unions, several international trade unions, and NGOs came together to create the Accord for Fire and Building Safety in Bangladesh. And they got major clothing brands and retailers to sign on to this accord. These are the brands that we're all familiar with that are listed on the slide. And it's those brands that contract with garment factories in developing countries to sew our clothes. So they wanted to ensure that those brands, through this accord, enforced safe and healthy conditions in those factories. This effort has continued over the last 10 years. And finally, 9 days ago, a new 6-year legally binding international accord was signed that will continue the health and safety programs in Bangladesh. It will continue the new program established last year in Pakistan, and it will expand the accord to new countries. It's an accord that's been signed by close to 200 brands and retailers. It focuses on independent factory inspections in those countries, remediation of hazards uncovered by those inspections, health and safety training of workers and supervisors, and a worker complaint mechanism. And they've also gotten the ILO involved to support these country programs. So important grassroots efforts. Another example of such an effort was also done in Bangladesh through various union and NGO groups in that country, together with 4 California occupational health and safety organizations. They developed a Bangla language occupational health and safety curriculum for a limited literacy audience using popular education methods. And they delivered this program through train the trainer efforts and that has reached more than 6,000 people over 3 years in Dhaka, Bangladesh. So a variety of programs going on at the international level to try to achieve decent work. If we wanted to try to take all these different types of interventions and put them in a model, it might look something like this. We took the basic NIOSH model of interventions and expanded it so that it covered aspects of decent work. We can look at prevention activities at the primary, secondary, or tertiary prevention level, and also programs and policies at the job level or employer level, or at the national or state level. And I've highlighted in red here some of the main types of interventions that have been conducted through the ILO and through other groups to try to achieve decent work. Laws, regulations, organizing, collective bargaining, and cooperatives. And in fact, if we wanted to make a really more complete model, we would need to add another row here. That is international agreements and initiatives, not just national programs. The ILO country decent work country programs and the various NGO campaigns that span different countries. So what types of decent work programs and policies then are being carried out in the United States or in other high-income countries? Well, we see a lot of the same type of programs. One of the types that's actually more common in high-income countries are these worksite-based participatory action research programs. Programs to achieve greater job control for workers, greater job security, more decent work schedules, better ergonomics, reducing hazards, a variety of different types of action research programs. These have been reviewed recently in a great review paper by Birgit Aust. This is worth looking at as one way to try to achieve decent work. But of course, there's all the other methods that the ILO has been promoting: laws and regulations, collective bargaining, worker cooperatives. And I've listed here some examples from the United States of efforts to improve health and safety regulations at the state or the national level, laws that promote better nurse staffing, laws that promote paid family leave or paid sick leave, and in general, better wage policies, worker protections, and rights to organize. In addition, there have been important gains in collective bargaining made in the US, starting maybe a decade ago with initiatives by nurses and teachers, strikes and new contracts by those groups, and now spreading to other parts of the economy. In this past year, of course, we've seen major strikes among package delivery workers, auto workers, actors, screenwriters that have been settled recently that have gained all those workers better income, better job security, better health and safety, better protection against some of the issues related to AI. So important initiatives going on in the US to try to achieve decent work. Now, if we want to try to compare the United States with other high-income countries, we're fortunate to have a recent study from Oxfam, which did just that. They took a list of 56 important wage policies, worker protections, rights to organize, to see to what extent these were being implemented in 38 different countries. And if you look at this list on this slide, this is very similar to the list of the basic components of decent work that the ILO has published. So this set of policies we could call decent work policies. How is the United States doing on these policies compared to other wealthy and some middle-income countries? Well, sadly, we're doing very poorly. The US is 38th, that is last among our peer countries in worker protections. We're right near the bottom in wage policies and rights to organize. And you can see on the slide here the countries that are doing best on such policies, primarily countries in Western Europe. In fact, because of this, several unions in the United States earlier this year filed a complaint with the ILO, arguing that US labor law does not protect workers' rights to freedom of association and collective bargaining, rights enshrined in ILO conventions and in ILO's Declaration of the Fundamental Rights at Work. So we have a long way to go in this country to catch up with our peer countries. But it's not just country differences. We can also compare states in the United States. And Oxfam did just that. They took that same basic set of wage policies, worker protection policies, and rights to organize, and compared the 50 US states. The states shown in green are doing much better on those policies. The states that are more red are doing worse on those types of policies. And of course, we can see that a lot of these red states are states that in our political jargon, we often call red states. Now, how is all of this affecting health in the United States? Because we're trying to connect decent work and health. What we can see here is that in the United States, our health is quite poor compared to comparable high-income countries. Our life expectancy was very similar to other countries back in 1980, but we have diverged a great deal since then. Life expectancy stopped increasing in the US about 10 years ago. Life expectancy declined in the US and in other wealthy countries during the first year of COVID, as you can see, but in 2021, the second year of COVID, life expectancy rebounded overall in other wealthy countries, but in the US, it continued to decline. And we now see a 6-year life expectancy gap between the United States and comparable countries. It's a health crisis going on in the US. We can also look at differences between US states and life expectancy, and there are big differences. It's a little harder to sort out using this particular graphic, but this is from a recent paper by Stephen Wolfe, Dr. Wolfe in the American Journal of Public Health, where he showed that the increase in midlife mortality after 2010 in this country was more concentrated in the industrial Midwest. The collapse of the manufacturing sector, well-paying industrial jobs moving overseas, the farm crisis, increased economic precarity, and shifts in a number of these states to more conservative health policies and labor policies. And he was able to show that states with more conservative policies have more of a stagnant or decreasing life expectancy and higher mortality. One more important disparity or inequality that we see within the United States, and that's the difference in life expectancy between people with a 4-year college degree, the blue line here, compared to the 70% of adults who do not have a 4-year college degree, the red line shown in this graph. That disparity, that inequality, was only about 2 years of life expectancy back in 1990. But now that inequality has grown to about 8 years of life expectancy. So we really have our work cut out for us. We've been doing a poor job in this country, making work decent and improving the health of people in this country compared to other countries. Similar inequalities in some states compared to others, and we've certainly been failing working class people in this country, as shown in this slide. A lot of work to deal with our decent work crisis and our health crisis. So with that background, I'd like to continue the discussion about decent work in the US and turn the screen over to my colleague, Dr. Pratap.
Thank you, Dr. Landsbergis, and thank you for setting the stage for this important topic. I'm going to talk a little bit about a study that was conducted during the pandemic in May 2021. We launched a study called the Decent Work Study, which was a qualitative study, IRB approved, in our School of Public Health. And the idea of this particular study, I'm trying to forward my slides. Okay, yeah. We had 2 large research questions, and one is, how is the concept of decent work perceived and categorized by multi-level partners at local, regional, and national levels? Because we say decent work, but what do people think of when we really say decent work? And what do they know about it? And what makes decent work? And how are we measuring it in the United States? And then what are the perceived facilitators and barriers to really implementing policies and programs to promote and support decent work? And so for that, we have to talk to people who may not perceive things like us, have a different worldview, which means have some tough conversations. So the research study was a great way of doing that, as well as we could in the 60 minutes that we had for each of these interviews that we did. In terms of the methods, we actually started the study in May 2021 with a literature review, and I'm not going to really focus much on that because Dr. Landsbergis has done a great job of laying the foundation about decent work and, and the state of decent work in the United States. I'm going to focus on the semi-structured key informant interviews that we conducted between May 2021 and March 2022. We did 42 interviews. Each one lasted about 60 minutes. And then we used probing open-ended questions that really attempted to understand how these partners perceived gaps and opportunities for decent work, and thinking about can we have a decent work agenda or framework for the United States? And then we used standard qualitative data methods to do the analysis, and we used the deduce software for analyzing our transcripts from these interviews. We spoke to partners from government, labor unions, stakeholders in the business area, small, medium, large employers, business and trade associations, workers, including workers who had quit the workforce during the Great Resignation, organizational psychologists and well-being experts, attorneys, labor and policy experts, public health folks, including international folks from ILO and OECD who gave us their opinion and their perception on decent work and in the United States. So as expected, less than a third of the key informants that we interviewed really were aware of, there is something called decent work or the ILO's decent work agenda. And it was interesting, as one participant stated, that decent work is not an American term, and it seems focused on incorporating the developing countries and emerging countries that had a lot of jobs which are really poor in terms of quality and pay. And many of them, there were some other participants also who kind of pushed back on the term decent work, saying that's such a low bar. I think we should be calling it dignified work or good work, or good jobs, instead of just, saying decent work, because that was such a low bar. Although, people didn't know much about the ILO decent work agenda or framework, still when we asked them, like, how do you describe decent work and what does it mean to you? The terms that they use in describing decent work were pretty similar to the ILO's decent work definition. They talked about respect, the overall sense of well-being, conducting, engaging in meaningful work, autonomy and power in your work, bargaining power, work-life balance, wages, adequate wages, affordable health insurance, the protections, having dignity in work, skills, to be able to grow in your jobs, and, other aspects as such. But overall, if you really think about it, many of them really characterize decent work in terms of dignity, respect, and the impact of work on people's lives, work that is fulfilling. Because, as one participant said, you can make picking up trash meaningful and noble, and it's an important job in our society. Someone's got to do it. But if they are respected and treated well, the hours that they work and what safety mechanisms are in place and what benefits they receive, that makes the biggest difference. Because, once you get past the wages and the two most important benefits, such as health insurance and retirement, I think for an individual, that feeling of, value of work and what they do for work is like the most important aspect. Really thinking about it, the idea of decent work is largely shaped by our cultural norms and derived at a political and societal level. Decent work is also the pathway to the most basic needs of survival. Like everybody agreed that, like if you really think about it, although it starts with pay and, satisfaction with benefits, it's really a means of providing access to healthcare and good schools, like the most important determinant of health. And increasingly what they were saying is that, we're saying that decent work is like a floor below which nobody should actually fall. And it's also that decent work is a human right, and it's foundational in order to lead a productive and healthy lifestyle. So we spoke to different kinds of partners or stakeholders, as we call them. And so I just want to present a few of the themes emerging from those conversations. When it came to conversations with the employers, the trade unions, the business groups that we spoke to, they kind of understand to some extent that they do have a societal responsibility to work with the governments to improve economic growth and also think about, health and well-being of the workforce. However, some of the deep-rooted fears and concerns are like, you just cannot have a one-size-fits-all approach to how policy is developed and implemented. For example, a small business owner who is already paying the minimum wage of $15 per hour to their employees says that they don't have, control over rising rent, or if their employee has transportation. And it was a similar feeling in, some of the people that we spoke to in the retail sector, these employers in the retail sector who talked about, they are like, their jobs sometimes vary seasonally. And so they can give the hours and people can have jobs there. But things like childcare and transportation that a lot of their employees work with are beyond their control. The other thing that the employers and the business groups really talked about was, the need for more data and clarity, because at the end of the day, it has to fit somewhere in their business model. And I think we all know that. And we can argue as much as we can, but I think, seeing how it fits into the business model, we can make a business case, but showing how it's done is going to be really important. So as one employer asked, like, how do you measure a good workplace? I mean, we have safety standards, right? And we have reporting that we have to do for maintaining certain safety standards. But how do you measure a good place? How do you know a workplace is psychologically safe? In terms of our conversation with labor economists and labor policy folks, there was this disappointment and kind of an acknowledgement at the same time that, labor policy folks really don't understand this larger, broader context of health. And at the same time, it seems like people in the public health world, don't really think about how labor markets work. So there is a gap there in understanding and in the language we speak and how we approach ththings. The other thing is the need for a simplified language to translate research into policy and action. So as one labor economist that I spoke to said that it really drives them crazy when they see all our frameworks with all the different topics bundled up into those frameworks. And for someone with their kind of training as an economist, it's really hard to pick something or kind of understand how to use those frameworks and models in translating into policy and action. So I think, there's a gap there in understanding the kinds of work that we do and labor economists do. The third group that I'd like to highlight is the worker group. So it was kind of, this was in May 2021. The study started in May 2021. So we were still in the pandemic with a lot of workers who, were quitting the workforce for many reasons. But, as one employee who spoke to me, who had recently quit the workforce, mentioned that, it really finally took this worldwide pandemic to sever the cord from this, horrible, stressful job that he or she was working in, and really thinking about, like, I need to prioritize my mental health and well-being because that's what matters more at the end of the day. But American workers, I think, have come to kind of accept the lack of decent workplace and jobs as something that is normal. For example, temp workers really think that decent work is a privilege that they cannot experience. And then, the gig workers, they love the flexibility in the jobs that they have, but not having job protections or social safety net, really like brings up this whole conversation about independent contractors and employees that they're constantly engaging in. So when we asked people about the role of public health, it was interesting. We had a few people saying, I've never thought of public health's role in really thinking about economic development. And when it comes to decent work, jobs and health, I never thought of it that way. And there were some people who were like, public health is not going to be able to do anything about this because, it's beyond the control of public health. But more than half of the participants really thought that public health policy can shape public policy. For example, the labor economists, really feel that there's this great opportunity because mental health is such an important issue. and it's often underestimated in its impact on how it is going to impact our workforce and participation in the workforce. And so that's an untapped area for collaboration. And then public health has, an important role in really helping employers understand their role in employee health and well-being. And how do you start making those connections with public health in a way that is mutually beneficial? And finally, thinking about building bridges and how we do research and how we put our research out there in journals and in scientific conferences, and really thinking about, how could we actually get the message out to all these partners in a way that is understandable and useful for them, that can actually shift public attitude and public knowledge. So some of the areas that, emerged in these conversations where we, can do more research and identify opportunities for collaboration is, many people may know what a good job is when they see it, but I think we need to have a shared understanding and definition, and this larger, understanding of what decent work is. If we are thinking about what metrics we are going to create on what makes a job decent, I think really thinking about that, because, as one employer said, is this a line like above which a job becomes a decent job and below which it's not a decent job? So really thinking about that. The other thing is the lack of available or access to quality data. If you really think about working conditions and health outcomes, we don't have that much of data. We have good workforce data on how many hours people work, how much they're making. But really, if you look at the other dimensions of working conditions, I think there's very limited research. It is happening, but we don't have the kind of funding or visibility available to do more of this kind of research. And as another participant expressed, we have very good employment data or we have very good health data, but, really where is the overlap, which is going to be more important for us to focus on. And then the concern raised by some of the workers and, representatives of workers who are in the shadow economy or informal economy or gig economy is, when we have these government reports and economic forecasts, are they including these workers as well? So I'm going to talk about the decent work. So that was the decent work study. And when the study was being conducted, a group of us, including Dr. Landsbergis, we were working on this decent work policy with the American Public Health Association Occupational Health section. And our policy was supporting decent work for all as a public health goal in the United States. So the American Public Health Association actually has a number of policy statements that recognize adverse working conditions, such as job strain, unsafe work conditions, and its impact on health, cardiovascular health and suicides, opioid use disorder and overdose among our workers. And there are also policies that really advocate and recognize the benefits of social and economic supports, such as paid time off and sick leave and union protections. And then there are policies that are specifically focused on certain worker groups, such as farm workers or temp workers or immigrant workers. But we wanted a policy statement that would be this broader umbrella that would kind of fold in all these other policies around aspects of decent work and explicitly link decent work and health with this overarching agenda for equitable and healthy economic development, which is in line with the Sustainable Development Goal 8 of the UN. So the decent work policy, the way it's set up is you describe the problem, which Dr. Landsbergis just did very beautifully. And then we talk about what evidence-based strategies are available if you want to align it with the 4 pillars of decent work. And so those strategies, some of them were US-based and some of them were international. And then we have action steps for Congress, because that's the way APHA policy statements are written. The action steps are usually for the higher level. It's talking to the Congress, it's asking for funding and research and data needs, and then, or maybe action at the state level. This policy statement was developed in a very collaborative way with APHA sections in mental health, pharmacy, community health, ethics, epidemiology, and was heavily endorsed by several groups as well. And I want to say this, that when we started working on this policy, we were thinking about a policy that would benefit our most underserved, discriminated, underprivileged worker populations, or historically disadvantaged worker populations. But we soon realized, as we started working with our other section partners, that decent work is central to a human-centered future of work for all. So as part of our dissemination efforts, we have actually published this decent work policy in the New Solutions Journal. We also have translated the policy in Spanish, which is the first time a policy statement has been translated in Spanish, and it's available on the APHA website. I have a link here, when you receive the slides, if you want to, read the policy in detail. It is a super long policy. It's about 13 pages long. Now, when we started our work, this decent work study, and then when we started doing our policy work, at the same time, there was a lot of other movement happening in the US economy. And the US Department of Labor launched the Good Jobs Initiative. It lists the 7 principles of good jobs, and with the idea of creating pipelines for good jobs and uplifting the economy. The US has also signed on to the ILO's Climate Action for Jobs initiative, where the focus is decent work and quality jobs as an integral part of transition towards environmentally sustainable economies. And then, of course, the US Surgeon General's call to action for the workplace mental health and well-being framework also was launched in the past year or two. So there are all these efforts, and then we have this uptick in the union movements that are happening. And I was talking to my colleagues recently from APHA, and they were talking about how in some of these pharmacy strikes that are happening right now, the decent work policy is being used in different spaces. So I think, based on what we know so far and the literature, and I'm sure there are lots of people working in this space, we just don't call it decent work, we call it something different. I think we know why it's important. We have a good case for why it's important, especially thinking about the future of work and how much of our workforce is still way behind. And if we don't have this human-centered approach to our future of work, we're going to have more populations being left behind. And we also know what is required in terms of where are the opportunities, where are the gaps, who are the people that we should be working with. I think the challenge is how, and that's where we as public health professionals and occupational health academicians and researchers and practitioners, need to start focusing a lot more on. And the good news is that there is a lot of great work being done. It's just that we often look for it in peer-reviewed literature where it may not be available or on platforms that we are more familiar with. So I just want to offer 1 or 2 examples of things that we've been doing. We've been involved in the Good Jobs Challenge in Chicago, really working with employers and some workforce development groups, thinking about is training for a job, good job, leading to a good job. We're working with the APHA Occupational Health section at CoshCon to really disseminate the decent work policy and engage in conversations about evidence-based strategies out there. And then the recent HERO conference, it was a pleasure to see that these large employers focusing on employee health and well-being, talking about the Surgeon General's framework and the WellBeQ survey. So last but not least, I think, Dr. Paul Landsbergis and I have been talking about how can we bring together a community of practice around what needs to be done in terms of metrics, surveillance, and research for decent work. So I'm going to leave you with that, and I think move on to the Q&A without taking any further time. And I just wanted to acknowledge all the people who've been involved in these efforts, whether it's the policy or the research. And a big thank you to the Occupational Health section, the Great Lakes Center for Occupational Health and Safety, and the Center for Healthy Work. Thank you.
Thank you, Preethi, and thank you, Paul, for marvelous presentations. I think you've put out a lot of useful information, and we'll see what the audience wants to talk about. So let's look at some questions. So people wanted to know, Sarah, if they can get a copy of the recording. You already talked about that. So
yes, we will try to post that within usually within a few weeks. So please just check back on our webinar webpage, and you can always email twh@cdc.gov to ask any additional questions.
Okay, here's a question for Dr. Pratap. Do you really think employers, corporations will ever accept the business case for collective bargaining? It hasn't happened in hundreds of years. Why do you think it will happen now or ever?
That's a great question. And I think there is a movement and people are fighting for it. If you look at the uptick in the activity among unions and just workers coming together, they are pushing for it. I don't know about collective bargaining per se, but I think it is all the aspects that make work good work is what is I think coming to the forefront. Because even at, there are so many organizations are measured, like have certain standards that they're measured by. Investors want to know, what are you doing in terms of X, Y, and Z? And now investors are asking them about environmental sustainability and about worker health and well-being. And I think if there has to be worker wealth and well-being, then, employers need to accept that workers are going to be fighting for these things as well. So I'm not saying that it's perfect, but if there is enough of traction and weight, it is going to tip the scale. And I think it is moving in that direction.
Okay, Paul, anything you want to add to that?
Sure. I mean, it's a good provocative question. I think if we look at some of the countries in Western Europe that we were comparing to the United States, countries that have much better health than us, much better wage policies, worker protections, and rights to organize, I don't know that they convinced companies in those countries of the business case, maybe in some cases, but mainly through political power, they were able to pass laws requiring bargaining, protecting workers' rights, and therefore bargaining is more accepted in that political and legal framework. So that's something that we can certainly work towards here.
Okay, great. Thank you. Another question is, lovely talk with focus on workers' well-being. What is being done to elevate categories of refugee, asylum seekers, and immigrants who are forced to work menial jobs and positions in spite of their higher levels of knowledge and skills? You both can have a crack at this. Preethi, you want to start?
It's a great question again. That's a big challenge. And I think, in our conversations with temp worker groups, this often comes up. It's not just the people who do not have qualifications, but people who are are well qualified, like doctors and nurses from other countries, who sometimes end up taking jobs that they're really not, that they're way overqualified for. So it is about underemployment, right? Being underemployed. And in the US, we really don't have a metric for underemployment. So I think, if we really want to use that talent that is available, we need to have a system for measuring and really finding out, where are these and what kind of, people who want to work more hours or have more skills, how can we connect them better to the economy? So for that, I think we really need to have more data, and we don't have that data.
Right, and I might mention that the literature on the health effects of underemployment show that it's often has the same kind of health effects as unemployment. So it's a serious cause for adverse health effects. Paul, did you want to throw in anything on that?
Sure, just to add that, many immigrant workers, especially those who are not yet citizens, other groups of workers, such as domestic workers, have been excluded from protections of labor laws. If they were included and had those same protections, they wouldn't be so easily exploitable and could benefit from the wealth in this country. So it's about inclusion, which is one of the things that ILO calls for decent work, not excluding groups.
Great. Question for both of you. Any thoughts about how climate change may influence decent work?
That is a real challenge, of course. Work is becoming more hazardous because of climate change. There's going to be more climate migration because of climate change. These are all challenges to our labor laws and health and safety laws. So just more efforts are needed to deal with that.
And I would also add that, all these initiatives where we're talking about climate action and jobs, it sounds really great on paper, but operationalizing it is the bigger challenge. So if we don't have this broader vision for what work should look like and have the basic principles of good work embedded in the jobs that are being created, then I think, more and more of our workforce is going to be left behind. And I think it's the similar situation with artificial intelligence as well, and, the machine learning and the digital, the new economy.
Okay, I'm going to throw in a question of my own here, something I've been struggling with. Maybe both of you can give some insight to this. How are we going to bring new occupational safety and health professionals along to better address decent work? How are we going to see decent work instilled in occupational safety and health curricula, I guess is another way to say it?
I think to start with, it's about our training. So as occupational health and safety professionals, I'm part of an ERC, and, we train the next generation of OSH professionals. And when you come from an ERC that is embedded in a school of public health, I think our students do get an understanding, this broader understanding of determinants of health and the role of work as a determinant of health. And so, there is some understanding of that. However, we're still largely a very technical field. And so to make that switch is a huge challenge. Where can you see occupational health and safety professionals really being part of these conversations about, well-being in an organization? We have wellness experts and well-being, it's embedded in HR, safety is separate. So really, thinking about, I think, some leadership skills, understanding those broader pictures, the broader picture of the role of work. I think that has to be part of the training, but giving them those experiences of working with leadership and working with other parts of the organization is going to be important. And that is something that we're trying to do as part of our total worker health research study that we're doing with equitable health and well-being in the organization, really bringing well-being, health and safety, all of them together to think about workers who are often not considered in developing benefits for workers.
Paul, anything further to add on that?
Sure. Yeah, I'm optimistic. I see movement in schools of public health and other training programs towards including more information on occupational health inequalities or social determinants of health, issues kind of related to decent work that are interdisciplinary. Those are being included. And I think because of the APHA policy document that Preethi described on decent work and maybe this webinar, the word will get out there even more.
Okay, here's another question. Can the panelists talk about their views relative to the need to address psychosocial hazards in the same way that physical hazards must be addressed under the OSHA Act as a strategy to address mental health for all workers? That opens a whole other chapter in some ways. Go ahead. Anyone want to touch that?
I'm going to throw that question to you, Dr. Schulte, because I know you have talked about it, about, a standard for psychosocial hazards.
Well, indeed, I think you can't talk about decent work without thinking about psychosocial hazards. Mm-hmm. Many of the things that Paul showed when he listed all the elements, all are in a sense psychosocial hazards to workers. So indeed, it's critical that the occupational safety and health field elevate thinking about psychosocial hazards at least to the level where we think about physical and chemical hazards, if not even to a higher level.
Sure, and if I can just add, yes, this decent work idea really does a great job of combining, including psychosocial hazards and physical hazards of work. And, what are the next steps? We do need more efforts to improve mental health of the workforce, but also physical health of the workforce from psychosocial and physical hazards. So NIOSH guidelines on psychosocial hazards at work and mental health would be one good step, and OSHA implementing such guidelines through the general duty clause or other ways to try to enforce mental health protections of the workforce.
Good.
And also to add one more thing, we need metrics though of how we're going to measure this, because a lot of this is fuzzy and employers don't like fuzzy. And so, we have to be more clear about what we're measuring, how we're measuring it, and speaking in a language that would, understand. So not just making the case, but showing how it's done. Yeah.
Okay, well, I want to thank, we're at 3:01, so I think we will have to stop the questions. I want to thank Dr. Pratap and Dr. Landsbergis for their marvelous presentations and for fielding the questions. This is a critical topic, and I think you're going to hear a lot more of it in the near future. So I'm glad we were able to present a foundation for people to think about what decent work means and how it relates to occupational safety and health. So with that, I'll say thank you all and goodbye.
Thank you.